And so stay right there because I think we're moving on to our COVID-19 staff update. So if we could get the rest of the team promoted. Okay, Marilyn, are you going to kick us off?
I am, thank you. Well, for those of you who are monitoring our case numbers, we've had a few added since last week, but we remain fairly stable with having added very few. I think we're at 1428 as of today. And today the state will tell us that, what our tier metrics were for the week ending May 1st. So today is our first day today marks our first full week of being in the orange tier. And we fully anticipate that the state will say, and we will be reporting today at noon, that our county metrics are below the 1%, are below 1% for positivity rate and below 1% for case rate, which is solidly in the yellow tier metric category. We have to remain in the orange tier for the next 2 weeks, and it is critical that our tier metrics over the next 2 weeks continue to be in the yellow range in order for us to be considered and move into the yellow tier on May 25th. But at this time, we are tracking towards the yellow tier, and barring any kind of unexpected outbreak, we anticipate being able to make that move. Anna's going to be providing us some updates on vaccines, and we continue to do outreach to really get the word out and expand our number of people vaccinated. And again, Anna can provide us an idea of where we're at as a county in comparison to the state, and provide, I think Dr. Richardson and Anna are also going to be providing some updates on vaccines. So I'm going to kick this over to Anna.
Good morning. Well, it does feel that though we're really moving in the right direction from a case rate perspective, we're still very busy in public health, and it was a pleasure to watch our COVID team introduce this morning. We have some outstanding team members that have come on to help us through this phase of our COVID response. And as I'm sure you all know, we've really been focused on our vaccine efforts over the past several months. And so just some updates around vaccine coverage. We are continuing to receive some data from the state level. It's not published publicly yet because they're continuing to work through getting additional data sources in. I believe we've talked in previous weeks about the challenges with incorporating some of the federal data where we have allocations directly to some of our pharmacies in the area. And then we also have allocations directly to from a federal level at Indian Health Services. So our Toyabe data is not fully captured in the state data at this time. So in partnership with Toyabe, we have been getting their updated information as well as they continue to provide vaccine, as well as many other providers in our community that are providing vaccine. And so we're showing and tracking above the state's vaccination rates, and still doing a really wonderful job in not only making vaccine continually available, but getting good coverage within the communities. So with the all of the different providers within Inyo County, if we look at the number of Inyo County residents who've been vaccinated, we're tracking at about 55% who are fully vaccinated at this point, and over 70% if we include our Toyabe vaccination rates, in addition to all of the other vaccines provided in the community. we're at over 70% on our coverage rate, which means people who've had at least one dose of vaccine. So we've really been doing a great job and have some really good partnerships with other providers within the community to make sure those vaccines continue to get to be available to our public. We have planned for this week in a second dose clinic. So we did a large Pfizer clinic in towards the end of April on the 24th and 25th at the Tri-County Fairgrounds. We are doing our second dose clinic this weekend at the Tri-County Fairgrounds for individuals who received their first dose during that mass vaccination event in April. We are looking right now at whether we can potentially open up some first doses. We have to get a few things in place. So if that is the case, we will be putting out some more information publicly over the next couple of days. We are having a little bit of a challenge with staffing the clinic. So we're working, of course, within HHS to find staffing to help support the clinic. We are continuing to work with Northern Inyo Hospital, who is providing shot givers and also often pharmacy techs and pharmacists to help us draw the vaccine. We have other partners within the community who've been helping with the vaccine distribution through other agencies like Vaughn's and Duane's, for example, Toyabe. We've had individuals who volunteered, but we are a little short at this point in volunteers. So we do also want to just make a plug for the public in general. We're looking for non-medical volunteers as well, and we do have shifts available this weekend. On Saturday, there's 2 shifts, a morning shift and an afternoon shift, or an all-day shift. And then Sunday, we're midday, so we go straight through in one shift, but start a little bit later in the morning. And volunteers can sign up through myturn.ca.gov. There's a volunteer site towards the bottom, and if you search by the zip code in Bishop 93514, it'll pull up the availability of shifts. So I wanted to make a plug there. We are excited to finish vaccinating about 600 people this weekend, and again, potentially may be able to open up some slots as well for first dose vaccine. We have at this point planned to demobilize, at least for the time being, mass vaccination. So we're not planning to do more big events at the fairgrounds, at least for right now, but focus more on expanding our network within the community. We are moving into a phase where, especially while we have to get very large allocations of Pfizer if we get the Pfizer vaccine, having Inyo County Public Health act as a hub to be able to get some smaller amounts out to our different providers, because right now many of our providers are primarily offering Moderna vaccine. We've had a good supply of Moderna and actually have quite a bit available right now within the community. We want to help our providers have an easier time distributing Pfizer vaccine as well. And so if we're able to help manage the storage of the vaccine, which has to be in ultra cold temperatures, and take just smaller amounts to each provider, we are working through a plan right now to be able to offer up more Pfizer-based vaccine clinics through our existing provider network. So really have been focused on building out that plan and working with our providers for that. That is important right now too, because we did hear yesterday that, and we knew that there was a potential for this, but we heard that the FDA has approved the expansion of the emergency use authorization for Pfizer at this point for younger children aged 12 to 15. And so the next steps for that are that tomorrow, the ACIP, the Advisory Committee on Immunization Practices at the federal level, is going to be reviewing all of the data that's been collected during clinical trials, and they're making a determination and a recommendation to the CDC around approving that expansion. So there is a review process happening still at the federal level through the ACIP. We are expecting that the vote will probably happen around noon tomorrow, so we'll know a little bit more tomorrow afternoon, we think, unless there's any kind of delay in that discussion. The next step would be at the federal level, CDC approves the recommendations of the ACIP, or considers approval, I should say. And then by probably Friday, we'll have some more specific information out from the federal level to providers around that expansion. Also, what will happen in California, Nevada, Washington, and Oregon is the Western State Scientific Review Committee will be also looking at the data that's been presented by Pfizer as part of that EUA expansion, and making some recommendations that will be incorporated, not only taking the federal recommendations around that vaccine use, but also CDPH will be also listening for any recommendations that come out of that scientific review, and providing some direction to us within the state of California around use of the vaccine for that younger age group. So we still have some steps to go through. I know there were quite a few headlines yesterday around EUA expansion, and just want to kind of talk through. There are still some review to happen. Of course, EUA stands for Emergency Use Authorization. So we want to continue to remind the public that, vaccines are an extremely, extremely important part of combating infectious disease. And in this case, of course, it's made a huge difference in our fight against COVID, and really has really very much made a difference for vulnerable populations that are most at risk for developing severe disease. We know these vaccines really help reduce hospitalizations and significantly decrease the chance of death when individuals who are at high risk for severe disease are vaccinated. So very, very pleased to have these EUAs in place for all of the different vaccines that have been approved, but they are still an emergency use during this pandemic. And so we want to just make sure that we're really following the science and the evidence behind them, and urging that particularly parents, as we start to look at kids receiving the vaccine, are well informed, are reading the information about the vaccine trials through the EUA documentation that is released, and are having some places where they can go to have discussions with trusted providers such as pediatricians. So at the state level, also as part of our vaccine plan, the state at the CDPH level, and also the third-party administrator that's helping to distribute vaccine at this point, as well as local health departments, have been working on how to expand to pediatric providers and have vaccine available through pediatricians' offices. We are continuing to have discussions about that. In fact, there's a webinar later today. There's a lot of discussion at the state level on how to do that, how to make the process more streamlined to bring some of these smaller provider groups on. We've been very, very focused on getting massive amounts of vaccine out through large hospital systems and very large events, and now we're kind of shifting not only locally but statewide to how do we make this vaccine available at places where people can take the time to talk with their provider about risks and benefits, and making the right decision for themselves and their families, but also so that we can start to really continue to focus on those very vulnerable parts of our population that either are hesitant to get vaccine or haven't had a way to conveniently access the vaccine. So in addition to looking at our pediatric strategies, we're kind of stepping back and looking at how do we make vaccine in general convenient for people to access and get the information out to communities and individuals who may be a little bit unsure about whether they should or should not be getting the vaccine. And so we've been working through a plan and some strategies around how to get better information out and how to reach out to these individuals within the community. So that's really where we're at as a team locally in Inyo County, in making that shift to start to do probably smaller types of outreach to reach some of these more vulnerable individuals. And with that, I think that is the extent of my update, one more thing I want to mention too is that we've updated our vaccine site. As we've had more staff join us, we've been able to kind of circle back around us to make sure that all of our information is getting updated in places that are available for the public. And so we've just recently published an update to our vaccine site so that it's easier to see where current vaccine appointments are available and which providers are offering which types of vaccines. So we'll continue to, as we look at making Pfizer more available in particular, updating that site so that individuals can find the place that's most convenient for them to access their vaccine.
And I'd just like to comment. I think what you're doing is, I mean, you guys have been through an unbelievable up and down on this thing. At first, we're turning people away because, you know, they don't qualify for vaccines and they're upset about that. And now we're trying to get them to encourage them to come. I think Jeff said at one time, now we have a gift certificate, kind of we go from the no you can't to how about a gift certificate for a vaccination. So, and I think also that convincing or not convincing, but talking to the people that give the shots that are not the government is really helpful, because we get these people who they see so many things on Facebook, they see so many things on the television. Most of them are encouraging vaccination, but Facebook is a whole, or the concept of social media is a totally different thing. You get the doctors on there saying that, you know, it's still it's a joke and stuff like that. So I think by talking to people that these people respect for whatever reason, whether it's the pharmacist or whether it's their own doctor, I think that's a really good thing, because oftentimes they will have more influence on people than, you know, press releases that we put out from HHS and you know, the government itself. So I know I've encouraged a lot of people to talk to their pharmacist. Most of them are getting some sort of pills or some using a pharmacy, and oftentimes they have that respect and confidence in those people themselves. So I know several of them have done excellent jobs of talking to people that really were afraid of getting the vaccine or didn't know whether they should get it because of their particular symptoms. So I think that's a real excellent idea. The other question I have is really for Doc, and perhaps Doc, you could sort of explain what the vaccine does. There's still some confusion about, you know, if I get vaccinated, now what happens? I can't get the disease. I can't transmit the disease. So maybe you could just comment on that. I think that would help.
Yes. When you get vaccinated, like most vaccines we deliver today, it increases your immune response to the body to fight off the infection if you get exposed to it after you've been vaccinated. The immune response is quite complicated, but they've figured out a nice delivery system with this messenger RNA vaccine to stimulate the immune system to identify the spike protein on the coronavirus and make antibodies against that, so you become immune to the disease. It's similar to measles vaccine or polio vaccine. Once you get vaccinated and 2 weeks after your immune response really kicks in, you should not be able to get the disease. Now, there are some breakthrough cases, but there are very few, meaning a person got vaccinated and they actually got the disease. Well, that probably relates to a situation where that person didn't have a good immune response, either because their immune system was depressed for some other medical reason, that they have concurrent medical problems. But by and large, the effectiveness of the vaccine is extremely well done. And it has been safe up to this point. They've given millions of doses of the messenger RNA. Aside from the problems they had for the J&J vaccine, it's very safe up until this point.
Thank you. I think that helps a lot.
Anna, on your statistic there, the 55% fully and the 70% at least one dose, is that the population over 16 or?
Yes, yeah, thank you.
Okay.
That is the population over 16 or the population that's currently eligible for vaccine. And in fact, this week, the state has adjusted their population numbers a little bit to reflect the most up-to-date Department of Finance population estimates for all counties. And so our population actually decreased a little bit. That's partially why we saw a jump in our overall coverage rates. So, I'm glad you asked me that question, because I meant to slip in that extra information about the data. And we are again continuing to add in the Toyabe information that they're providing us on a weekly basis. That's not part at this point of the state's data that they're sending us. So.
Okay, great. Because whatever you find on the state website or the LA Times tracker is always a different number. So it's good to know what we're measuring. And so do you have an idea of when we will know whether or not they'll be open up to first doses at the clinic this weekend? And if we're not doing any mass clinics, where will those folks get their second dose?
Yeah, that's part of the reason I'm not quite ready to say for sure, because we will have to just dealing with the details of having those individuals sign up for the first dose. We know we're going to have vaccine available, but then we have to make sure that the second dose is available. And while we're working to have more regular Pfizer clinics available through other providers, what we'll probably need to do is set up just a second dose clinic out of public health, just to get that group covered and know that we have them covered. So we are working through making sure that we have the staffing available. We have a location that's suitable, because we will be demobilizing our clinic for right now at the fairgrounds, and need to set up the schedule so that when someone makes a first dose appointment, they have that second dose appointment already available. So hoping by tomorrow morning is our drop dead date of making that decision. We'll have to get some information out via press release and really push some information out like we did before the last mass vaccination clinic to get information out within the public. But for right now, we know we're doing second dose clinics this weekend for anyone who was received their first dose of Pfizer through us in late April.
Okay, great. Then so I just had a question on testing. Are we still seeing people getting tests? And how long will we continue to operate that site?
We are still, at this moment, we still have testing set up through OptumServe in Bishop and Lone Pine. We've not made any adjustments to that schedule. So as of right now, we have still Monday and Thursday in Bishop and Tuesday and Friday in Lone Pine. Bishop's at the Tallman Pavilion at the fairgrounds, and Lone Pine is at Statham Hall. We are looking, I have been talking with our OptumServe partners, and we're seeing a pretty significant decline in the number of people who are coming in, some low utilization, particularly in our Lone Pine site. So we're looking at the potential to either reduce the times that are available on those days. So when we had the Verily testing site, we were only operating for about 4 to 5 hours per day. For the OptumServe, our lowest option was 8 hours per day. So I am working with the testing task force around whether there are other options as we start to see a decline, I think generally statewide with the demand for testing, but still continue to have some testing options available. So we're having those conversations right now, and also looking at the potential to use those sites for one more place for vaccine distribution, if that even is needed, as possibly even a mobile site. So we're looking at some different options. At this point, haven't made decisions, but I do anticipate that over the next month or so, we'll probably reduce the number of hours at the very least, just because we're not seeing as much of a demand. And that's because we don't have nearly as many people who are symptomatic at the moment. And
right, and people who are vaccinated, they're not doing the pre-trip.
Right. We're reducing the number of people who are required to be tested on a regular basis as well through work with the more people that are vaccinated.
Right.
Yeah, I would like to expand a little bit on some of what Anna's already spoken about, if possible. If anybody doesn't have any more questions for Anna, I'd like to expand and take a couple of minutes and expand on what she said. The entire past year, as everybody knows, we tried to decrease the cases, decrease surges at the hospital level, and decrease the deaths. And that was originally proposed to focus in on the elderly population and the vulnerable ones that had comorbidities and were elderly and had the greatest risk for severe disease and death. So I think, as Anna's pointed out very clearly, we in this county have done very well with containment, mitigation, and vaccinations. And we have our numbers down, and I think they're going to continue to go down. When you translate that into the unofficial US caseload, which is 33 million as of today, and approximately 582,000 deaths. Now, the deaths have dropped down to a level where we were last July. The case rate has dropped down to a level consistent with last September. So I think nationally in our county, we're all doing well. So this brings up the new vaccination authorization approval by the FDA that Anna mentioned with the 12 to 15-year-old Pfizer vaccine, which is a dose that is the same as the adult dose, given in 2 doses 3 weeks apart. The study of Pfizer did was on 2,260 persons in the trial from 12 to 15. It was a 1-to-1 trial. In other words, for each person that was getting the vaccine, they had one in placebo. And there were 16 cases of COVID-19 in the placebo group and virtually none in the vaccine group. So it had 100% efficacy in that group, that 12 to 15-year-old. But most would agree the power of that trial is very low because of the low numbers in the trial. So the vaccine in that group is safe and effective. They've proven that it delivers quite a bit of antibody response, which is good. My question that has come up is, since we're doing so well, why are we going to dip into the younger age range? And they're even talking about possibly creating the vaccine and studying 6 months and older. The only part that I've noticed that they state is useful is to create as many people vaccinated, and I assume they translate that into herd immunity. I have a little bit of a concern about this approach because I'm not sure we need to create herd immunity. There are only 7% of our population that age range, and maybe only half of those will consider get vaccinated. And I want it to be clear, I think this is an excellent vaccine. It works quite well. It has a tremendous efficacy, much better than any flu vaccine we ever had. What I'm concerned about is the timing. The timing of this vaccine at this point, when we're doing so well, especially when this age group is not vulnerable. The death rate in that group was low, very low, probably negligible through the past year. And they really do not have a major impact on the prevalence of the disease and the activity in the pandemic. In the news, in the past year, 18 months, you haven't heard hardly anything about children except for the multi-system inflammatory disease that they get, which is not in this age group, and it's extremely rare. So one of my concerns is that are we doing this a little bit too early? I'm anxious to see what the ACIP, the Advisory Committee on Immunization Practices, is going to come out with tomorrow. My concern is the vaccine for this group is maybe a little bit too early since we're doing so well. That doesn't mean I don't think that those children should not get the vaccine. What I do mean is that if they are going to get it, there needs to be full informed consent and full disclosure to the parents. So it's just not a given that you're getting the vaccine without any information. And they should have fully informed. In our county, I think we should have informed consent. We should enlist maybe county council into helping us make sure that we provide that to the parents, because I think this point about the 12 to 15-year-olds, like I said, is questionable in my mind at this time. Next month, next 6 months, it may be proven to be an absolute necessity for other reasons, and the safety would be proven much stronger over time. I don't know if the long-term safety factors has been considered in this. Look what happened to the J&J vaccine. After they got from 44,000 to 6 million, they started seeing cases of problems, although rare, and the same with AstraZeneca. Although I don't think the messenger RNA vaccines are in that kind of a category, they're totally different. But there's a lot of unknown factors about this disease and the vaccine right now that we don't know about. The vaccine, that is, in terms of long-term outcomes. So it'll be interesting to see what the ACIP recommends tomorrow. And to see if anybody has the concern that I do about the vaccine, at least at this time.
Well, Doc, doesn't that bring up a really important point that, if we stay with the adults, the argument that, I really shouldn't get, in my opinion, that works towards all the adults going and getting vaccinated. It shows that, at some point in time, maybe it won't matter with the younger generation, or if it's even shaky at all with the younger generation. But I think that what it should encourage adults to go ahead and get that vaccination, because that way you're protecting. And the other thing I thought about is that, we look for this herd immunity in a lot of areas that's really pretty focused into that area.
Right.
Where we are, we're subject to a whole bunch of other stuff. It's a tourist economy that we have. It's a tourist place that we live in. We always, on any given day, we have 30,000 people up here from some other area. So it would seem to me that it's even more important to protect the children and protect yourselves so that everybody, all adults, should really consider that vaccination, to go ahead and get it. Even if you're not protecting yourself, even if you don't care about yourself, you're protecting others that way. Maybe it's your children, maybe it's somebody else. So I think that was a real valid point with the children. But I think that even for me, it implies for the adults to move forward on this, to talk to people, to get educated, and go ahead and get vaccinated.
Yes, I think that's really important for the adults. All of us are aware that we volunteered ourselves to get an end to this pandemic by getting vaccinated. I got vaccinated. I'm not a vaccinating resistor or an anti-vaxxer. I have just watched the vaccine process slowly drift in, even though the vaccine was studied in the 16-year and older group in the Pfizer. They dropped that down, and we did vaccinate from 16 and older. We had a clinic for that. Anybody that wanted to get a vaccine from 16 and over. And now they're lowering it even further. And the only question I have is, what is the benefit? What are we trying to achieve, except for Mr. Pucci, you've alluded to the herd immunity. We may be reaching that without exposing the younger kids at this time to the vaccine. Later, that may be an important point to include them. But I think the power of the study with 2,260 people in the trial, and the lack of knowledge on the long-term side effects raise questions in my mind. I'm willing to take the risk because I want to do my part and show everybody that the vaccine is safe in our age range. And the vulnerable people, the whole idea was to keep the serious disease down, keep the surges down in the hospital, and keep the death rate down. And like I pointed out, everything is pointing in that direction without vaccinating further in the lower age groups.
Totally understand. Thank you.
Well, and I
Hey.
think Dr. Richardson, I think you really speak to the importance of parents making informed decisions in consultation with their healthcare providers.
Correct.
Healthcare providers that can help answer those questions. And so, just as any parent would for any kind of vaccination, understanding and making an informed decision.
Yeah, I think that's key. I'm not opposed to them getting vaccinated per se, as long as the parents are fully aware of informed consent. That's basically what you're referring to, Marilyn. Yeah.
One question or one comment, I guess. We're still, the vaccines that we're using, we're still under, they're emergency?
Yes. EUAs.
And so maybe the answer really is that as we get past the emergency declarations for these vaccines, that maybe the time for to lower the age is as we pass the emergency, and now the vaccine approvals are not emergency approvals.
Right. It takes time for it to get registered by the FDA as an acceptable vaccine. They can bypass that period by getting an EUA, and I think that was a very important step to get this pandemic under control.
Yeah.
But to get the vaccine fully licensed, that's going to be 2022 or early 2023.
Well, and I do know, I mean, I think there are parents who really want to have their kids vaccinated and I think that it's important to be able to accommodate them, because for lots of reasons, travel or grandparents or, whatever. But then I do think that this thought that, really locally we're doing very good and maybe don't need to, I mean, I want to make sure it's available, but maybe just make sure that people understand that we're still in the approval is still an emergency approval, and the time will come when it won't be an emergency approval. I guess, I don't know. I'm not a doctor, so I'm just.
And we will. Our focus is, one, make sure that the vaccine is available. Continue to look for possibilities of expanding access through other providers. Or other methods of getting the vaccine out. Even though we're under an emergency use authorization, there still are high standards for vaccine safety, and that'll continue. I mean, all of these clinical trials are continuing as well, but we do want to make sure that people are are making the right decision for themselves and their families, and taking into account all of their particular situations, risk factors, and just being informed.
And just one last comment, Doctor, could you possibly address the issue of the variants, and if we don't get enough people vaccinated, that what the variant, the potential for a resurgence because of variants are?
Well, yeah, currently the variants are propping up all over. The newest one is an Indian variant out of India. Fortunately, we only have the UK variant. I think it's B117, I believe it is, or B116. And the vaccines are apparently effective against that variant. The other variant is the South African one, and then there's a Brazil variant. Now, as these variants mutate, and that's what it is, it's a variation on the original virus. When it mutates, it becomes a variant. But it's basically a mutation, and viruses do this constantly. Apparently, they constantly are in an environment mutating. They're kind of like an evolving organism, constantly changing its DNA structure. So, as long as they don't get too resistant to the vaccine, and currently Moderna is tweaking their next vaccine, which may be out this summer as a booster, to include the variants. So in general, right now, the vaccines we have in this country are doing quite well in protecting us from the original novel coronavirus and these variants as they crop up. But for the future, I can't say. It's a matter of time, and I'm sure the big tech companies are planning to adjust their vaccines for these viruses constantly.
If you've had one kind of a vaccine, the Pfizer vaccine, and then this summer the Moderna comes out with this other one, can you get another? Can you go get the Moderna vaccine, or should you stay, or do you think it's going to be you have to stay with the one you got?
Well, that's a good question. I don't know if there's any guidance on that. Currently, if you did get one dose of Pfizer, you're not supposed to get a second dose of Moderna. You're supposed to stay with the same vaccine. But you're talking about a situation, if you're already fully vaccinated with one, can you get a booster from another? I suspect that's going to be a yes, but that question I have not seen answered.
Mm-hmm. Yeah, thanks.
Okay, everyone, it's 11:30. Are we done with questions for the team? Okay, thank you so much. And we'll move on with the rest of our agenda.
Thank you for all your work.
Yeah, thanks.
Actually, Mr. Chair, I did have one comment. I hope that I really appreciate Dr. Richardson and Anna's information that they provided for us. This, to me, is what I need to hear from public health as a person who doesn't understand, medicine. So I appreciate what you shared with us today, and I hope you'll bring more of that kind of information back to us. So, and I also wanted to publicly thank public health for what they did, working with and educating and consulting with the Mule Day celebration. So I just wanted to thank you for that.
Thank you.
Okay, we'll move on to item number 6 from the Agricultural Commissioner, and that's request the board consistent with